Okay, so welcome you, and it's Lorenza Leita speaking. I'm the Feldenkrais for Life project coordinator, and I will lead you today through this today meeting. And first of all, thanks for participating this evening. It's the third and last one planned by the project, aimed at everyone who is interested to know something more what the Feldenkrais method is, who the Feldenkrais practitioners are, and what role that somatic disciplines play in the ecosystem of health, mental health, or even better, global One Health. So today here with me, there are some colleagues from the project partners, and I'm pleased to introduce you Uwe Jaschke, that from the German Feldenkrais Guild, project partner and president of this association. It will help us to keep time and also to collect your questions in chat, and helped by Marta Zardini, a colleague of mine from the Italian Feldenkrais Guild. There are then also Aronne, uh, um, Aronno, that is our Gavazzeni, that is also a colleague from the Italian guilds. Then we have introduced you Sonia Fara from the Italian Association for Fibromyalgia Syndrome. He's a partner of the project, and she will present us some outcomes from the project activity. Then I think that there are some others. I don't know if Antonia Strangero is with us, but she's representing IFF, International Feldenkrais Federation. But then I'm very happy and pleased to introduce you our special guest. That she is Sandra Köke, team leader, emerging health threats and the One Health approach from JRC, the European Commission's Joint Research Center. And finally, I thank and greet also the other special guests who are not with us today, but they accepted to be interviewed. And so you will listen to the interview today, and I will show you later. So the Feldenkrais is the first European-funded project under the Erasmus Plus program that Feldenkrais community here in Europe has submitted and promoted in 2023. It's close to the end. It will finish in January 2026 and has been including 4 main activities. The first was a cross-country survey to understand better who Feldenkrais practitioners are and how they work and how they see themselves as professionals. The second activity is a web space to promote open resources and multiplier events such as this one. The third activity is a pilot training pathway to explore and transdisciplinary continuing education with the participation of both Feldenkrais practitioners and physicians who share their experiences and points of view in treating patients with fibromyalgia and chronic pain. And the fourth and last activities of the project is an institutional recognition to strengthen the identity, the presence, and the role of the Feldenkrais practitioners within the country's healthcare systems and policies. So you can reach much more about the project on the website. I invite you to go there. Maybe someone can send you, just add the link in the chat. But now I want to introduce you the today meeting, which intends to deal with 2 main questions. The first question is, how does Feldenkrais fit into the broader field of somatic health disciplines? This is the first part of today with insights from our cross-country European survey. And the second part replies to a second question. So, what are the opportunities and challenges of integrating somatic disciplines into preventions and patient care? And this second part will introduce you some outcomes drawing from the pilot training pathways delivered by the project, and also will offer you some interviews with external speakers involved in this context of work and research, and which help us framing the questions and the key points when we talk about global health, One Health, and transdisciplinary collaboration. So I think that we can go to the first part. And the first part deals with here the insights. So how does Feldenkrais fit into the broader field of somatic health disciplines? So here there are some insights. I hope that all of you can see the presentations. This was a cross-country survey that we did the last year, the last June in 2024, and investigated on professional identity of Feldenkrais practitioners and their user to collaborate and network. So we collected 776 replies, and we evaluated it as representative sample of the Feldenkrais practitioners who should work across Europe. And they came mainly from the project countries, partner countries, so Italy, Germany, and France. But they were also replies coming from 18 more European countries, such as Switzerland, United Kingdom, Spain, Austria, the Netherlands, Czechia, Belgium, and some more, but with minor numbers um, of replies. So, who are they? The sample showed us people who are about, 50 and 70 years old. The median value is 59, and they are male women. The interesting thing is that they are people with multiple qualifications. So they are highly qualified from education and training, from healthcare, that is quite interesting for us today, healthcare backgrounds, and one out of four people were also qualified in performing arts. They are people who have, anyway, multiple jobs. They don't work not only with Feldenkrais teachings. And in most cases, Feldenkrais is not the first job. Only less than 1 out of 5 people have Feldenkrais teaching as a first job. And they are mainly self-employed. That makes, okay, we'll see how they work. We ask them if they are used to work in team. And the entire sample, you see here some percentages, and more than half are not accustomed, declared to be not accustomed at collaborating. Only 2 until 4% are regularly involved in multidisciplinary teams, and with whom they are used to work with mostly, at most. They work with physiotherapists, with psychologists, osteopaths, psychotherapists, and also people coming from educational sectors such as teachers and coaches. In these surveys, we tried to profile the Feldenkrais practitioners and understand what kind of skills he has. And for this part of the questionnaire, we based our questions on some very known framework that European Commissions promoted, such as Entrecomp for the entrepreneurial competencies and LifeComp for the soft and transversal skills. And a third framework we based on also comes from our Feldenkrais community because we finalized a Feldenkrais competency framework in the part 28, 20 and 10, so more than 15 years ago. So about entrepreneurial skills, respondents declare themselves open and able to seize opportunities in entrepreneurial competencies. Much less in finding resources and turning in ideas into concrete actions. So implementation is much more difficult for them. They are sufficiently confident in financial management and engaging others. They feel themselves open to collaborations and learning from others, but they feel themselves insecure in managing interdisciplinary collaborations and most of all in the communication with other kind of professionals. So the dialogue with a specialized healthcare audience, such as physicians, is much less easier than it could be. So finally, collaborations within the professional association, because Feldenkrais community is organized in national guilds. And here you see, based on the Feldenkrais competency framework, we ask them to say to us how much time they devote to each area. And you can see about 50% of the working time is devoted to teaching classes in awareness through movement lessons and teaching individual lessons, the functional integrations one. Just 25% of the time is for personal and professional development, so they dedicate to continuing education, and much less time is spent on business organizations, and the fewest time is devoted to work within association. So this explains to you how they are used to network within the Feldenkrais community. Important to note is that 31% of the sample even is not associated to any national guild. So they are individual freelance. So the emerging big picture that I wanted to show you at first today is Feldenkrais practitioners that looks like a highly qualified worker, self-employed, potentially interdisciplinary professional, often combining Feldenkrais with other fields in which is qualified, but yet facing challenges in networking, financial confidence, and multidisciplinary collaboration. While they are open to learning and innovation, many practitioners work and continue working individually with limited integration into a broader health systems. And this is a limitation of which we would like to talk about today. Daytime is mostly devoted to teaching and continuing education with a minimal engagement in association or research. So this is just the overall picture we wanted to give you, a very partial and synthetic excerpt from the project survey, but I remember you that you can find the full report on the project website. So, going back to the initial questions, how does Feldenkrais fit into the broader field of somatic health disciplines? Health is understood as a dynamic balance between body, mind, emotions, but maintaining it during the prevention or healing process is complex. And the professional world has been enriched in recent years by many specialized figures, which can contribute with different approaches, but they should integrate to each other in a multidisciplinary and transdisciplinary perspective. Hence, some conditions are required. At first, they should be visible enough. The second, they should be ready and mature to collaborate efficiently and productively together. And third point, they should be included and managed within a common vision, a common framework, a context of use that makes sense to healthcare systems and policies. So the last thing that I wanted to say to you in this first part of the meeting is that the project Feldenkrais for Life intended to contribute with such multiplier events, the web space and with open resources to make it visible. But last year's another very interesting project offered a series of appointment and online events to promote the Feldenkrais method, and it's named Feldenkrais Education. Today we have not a chance to interview them, but they will be present in the final event of this project. So I invite you to be present in January, so you will be able to listen to them, because this is a very good practice. It provides an online platform where anyone interested in the method can find resources that explain the method, interviews to interesting stakeholders, practical sessions to experiment it directly, and reference of studies and so on. So it's really a good practice and that try to reply to such a need, how to make the method, this Feldenkrais method and the benefit of this practice more visible. So this was a first overall pictures, and I don't know if we have already any questions from the chat. We could leave some minutes to reply.
There are no questions yet, so I propose to go forward with the next topic and maybe have a bit more time in the end for questions there.
Okay, wonderful, thanks. So, the second part, we wanted to try to reply to the second question. So, what are the opportunities and challenges of integrating somatic disciplines into preventions and patient care? So, the project, I think you understood, that has a focus on chronic pain and fibromyalgia. This is thanks to the fact that we had the opportunities to have ARSF, the Italian Association for Fibromyalgia Syndrome, as a project partner. But not less important is the fact that chronic pain and fibromyalgia are medical conditions that have been rapidly increasing in recent years. They concern millions of people that are affected by this syndrome. And this syndrome affects people of various ages and conditions, include diseases and disorders that can also coexist with other primary illness, affecting diagnosis, treatments, and overall health outcomes. So let's start with the experience of the project Feldenkrais for Life and its joint training pilots. Because we wanted to test some pilots, how continuing education can be a lever of integrations, integrating professionals with different backgrounds and point of views and approaches to the patient. And we learned some lessons from the two training pilots we delivered in Italy and in Germany. So now I'm very pleased to introduce you Sonia Farah, a biomedical engineer and partner of the project. She belongs to the partners AISF, and she will explain to you the key opportunities and challenges emerging from the Feldenkrais for Life pilot courses. So thanks, Sonia, to be with us, and I share your presentation so you can start your speech.
Okay. Thank you, everyone. Good morning, and thank you for being here today. I will briefly present the key opportunities and challenges emerging from the Feldenkrais for Life pilot courses, focusing in particular on the Italian and German experience, as Lorenza said. I want to precise that we already have an experience of that in 2021, probably during the next meeting we will share all the results that we had collected during our experience. Starting from the conceptual and methodological alignment, we can say that both pilots are grounded in the same conceptual framework, fibromyalgia and chronic pain, that are complex conditions that cannot be addressed through a single disciplinary lens. So for this reason is needed a multidisciplinary take of care. Our starting point was the need to integrate medical expertise, somatic education through the Feldenkrais method, and the lived experiences of patients. The Italian pilot represents the first full-scale implementation of this model, while the German pilot served as a contextual adaptation and feasibility test within a more constrained healthcare environment. So the shared objective was to build a joint and multidisciplinary training, and most importantly, a common language. We can see the structural differences between the two pilots that we had. Italy involved a balanced group of patients, physicians from different specialties, and Feldenkrais teachers that supported by a strong institutional network. In Germany, participation was more limited on the medical side, with difficulties in recruiting external physicians. So the pilot relied mainly on internal professional resources. In fact, we can see that the physician enrolled in Italy were 12. In the German pilot were 3, and the patient with fibromyalgia were also different. These differences are important because they strongly influenced both implementation and impact. Starting from that, despite the contextual differences, the educational pathway followed the same logic in both pilots. So we started with surveys to map the initial knowledge and difficulties that followed by national and international alignment meetings. Asynchronous clinical and Feldenkrais modules built were shared for the knowledge, while the joint camp sessions allowed the professional to experience the method directly. And finally, the camp sessions with patients created a shared learning space for teachers, doctors, and patients. After that, we can say that, next slide, please. After that, we can say that the evaluation strategies differed between the two pilots. So the Italian pilot adopted a structured mixed method approach, including validated clinical scales and statistical pre and post analysis. And the German pilot relied more on self-report questionnaires and qualitative feedbacks, but always with a important. And methodologically different, both approaches show with current and convergent trends. We can say that in Italian, the pilot patients show with clear improvements in psychological well-being, physical conditions, and self-awareness. In fact, more than the 80% reported a reduction in anxiety and stress, and increased the energy, and we have also the greater involvement in their healing process. What is particularly relevant in this high perceived value is that almost all participants describe the experiences as enriching and empowering. One participant summarized it very clearly: "I feel powerful." Yeah, for the German pilot, instead, we have quantitative trends in the next slide. In fact, the German pilot showed consistent directional improvements. The stress, anxiety, and physical condition improved, and most participants reported better coping with chronicity and more active role in their own care. Even with a small sample, the trends strongly support the feasibility and the relevance of the model. If we're gonna go to analyze the comparative interpretation, if we look at the two pilots together, a clear picture emerges. Italy demonstrates statistically robust and clinically meaningful improvement. German confirms feasibility, adaptability, and experiential impact, even in more challenging institutional contexts. Despite the different levels of formalization, the effectiveness converges. We can pass to the professional outcomes. In fact, are one of the most important results of this project. In Italy, physicians showed a clear epistemological shift from a corrective view of movement to an educational one. And this change happened mainly through direct bodily experience and not through theory alone. So the camp session with the physician, the initial camp session, were important. In Germany, professionals reported increased confidence, pedagogical clarity, and stronger internal networks, although systemic impact remained limited by the structural constraints. If we go ahead, we can say that these slides can summarize the results. In fact, as we say, across both pilots, we have the effectiveness of small, precise movement, the reduced fear of movement, and improved body awareness and autonomy. A shift from a pain as enemy to a pain as information. And a shared insight was that doing less more attentively enabled greater functional capacity. If we go to analyze the strength and weakness of the Italian pilot, we can say that Italia's strengths lie in its strong network, robust co-designed, and clear clinical outcomes, but at the cost of high organizational and facilitations demands. If we go to analyze the strength and the weakness of the German pilot, we can say that the strength is the adaptability in a constrained system with positive patient-reported outcomes, but with clear limits in institutional recognition and physician recruitment. Taken together, these weaknesses are not failures, they are design indicators for future scalability. In conclusion, we can say that the Italian pilot demonstrates effectiveness and methodological maturity, and the German pilot confirms adaptability and feasibility. Together, they offer complementary and robust evidence that joint training can be a powerful lever for integration at European level. Thank you very much for your attention. I will be happy to discuss with you for questions and reflections.
Yeah, thank you for presenting these project outcomes. They took a lot of time and effort from us, and now we are very happy to start offering you the outcomes of these activities. We understood that creating a common language, or even better, a basis for a mutual comprehensions, emerged also as a key point to foster interaction among professionals with different backgrounds and approaches. I think that we are perfect in time, and we are really pleased to have our special guest, Sandra Cook. And so, if please, I just invite you, if you have any comments or any questions to ask us for, feel free to do that, and even now, okay? Because I know that you have a big experience on that.
So thank you very much, first of all, Lorenza and the whole team for inviting me. Maybe the only thing I can share is, first of all, I was looking very intrigued to the presentation, also the last one of Sonia, because I see also that you used the HATS survey system, which we have been also using for depression work. So I see some, let's say, some overlaps there. But moreover, I want to be grateful to all of you, because in 2015, I was severely intoxicated by an anti-leukotriene that I used for my therapy of asthma. And so one of the things that I decided to do, because mobility was very low, I was severely impacted by, let's say, this toxicity, which was completed, let's say, at the target system and target organ level. And I started to do myself Feldenkrais therapy. So I must say, at that moment of great vulnerability, for me, it had both beneficials at the level of mobility, but also, let's say, at the level of, let's say, mental health. Yeah, and we see already the results between anxiety and stress also in let's say, the presentation now. So I must say, so I have a background on this, and of course, I've been trying now to link the area of research. I've been doing quite a lot of areas of research, always in terms of adverse effects and One Health, let's say, worlds, combining them. So I see a lot of synergies in what was already said, and I'm very pleased to see also the results of the two studies done in Germany and Italy. So I leave it by that, Lorenza. So thank you all for being great ambassadors and professionalists in this area of Feldenkrais, which I appreciate a lot. Sometimes time has been restraining for me, but I should restart with a new long-term session of Feldenkrais. So that's my let's say, 2026 New Year's wish to all of you.
Okay, thank you. And yes, we wish you as well to find the new training the next year. So, so far, I think that we can introduce you the 3 interviews that we did with external speakers, 1 interview with Sandra, but we recorded them, and you can find them in full version on the project YouTube channel. Today, we will show you just an excerpt because of time, lack of time. So they present free experiences that address fundamental issues for promoting the integration we are interested in. So the first issues concerns continuing education as a lever for supporting professional collaboration according to an integrated health paradigm. The second issue is research and studies supporting scientific evidence in a global single health perspective in support of policies. And the third is research and studies supporting the validity of the Feldenkrais method within the multiple somatic approaches that exist. So the first interview is with MIBES Academy. It shows a novel and promising e-learning platform. It's a good practice in Italy to foster a community of users who promote the paradigm of integrated care, the psycho-neuroendocrine immunology paradigm. So it's dedicated to healthcare training and health promotion, with courses and services aimed at professionals in the healthcare and complementary medicine sectors, students, and also patients. So let me share with you the interview.
MIBES Academy is the first Italian e-learning platform dedicated to the healthcare field and health promotion. It was founded in 2021 with the aim of combining the advantages of in-person training with online education. Recorded videos can indeed be watched as many times as needed, while live sessions allow people to focus on clinical practice.
Okay. Well, I can answer you that at the beginning, our focus was mainly on manual therapy professionals. Today, our community is much broader. Physicians, physiotherapists, psychologists, nurses, pharmacists, patients interested in managing their own health, and teachers of various body-based and somatic disciplines. In addition, I can tell you that the platform now includes over 5,000 registered users with a wider community of more than 20,000 followers across our social media challenges and other 20,000 subscribers to our mailing list. It's a complex question because we are observing a growing demand for content that addresses both scientific foundation and practical, clinically applicable tools. The most requested topics include integrated clinical reasoning, management for chronic pain, stress-related disorders, functional disorders, postural and movement-related complexity, and on clinical protocols, and I can tell you communication and patient education. We are seeing that people now in this period are no longer seeking knowledge alone. They want to understand how to work more effectively with patients. So how to integrate approaches, how to communicate, how to collaborate. Practically speaking, the platform is moving toward modular building block learning models, allowing each professional to construct their own personalized pathway. So we combine high quality asynchronous theoretical modules, live session for real-time interaction, and intensive hands-on practice in small groups. So healthcare education must be, for us, a concrete bridge between knowing and doing. This is why we have moved from simple forums to thematic working groups, shared clinical cases, and a regular meeting with faculty. The platform so has become a sort of virtual clinical environment where participants do not merely attend lessons. They grow as a community that reflects, debates, and updates itself. Today, healthcare professionals need a scientific and epistemological framework that embrace complexity. Traditional healthcare education rarely teaches epistemology, so many clinicians still rely on a positivist vision model, where phenomena are induced to simple linear explanation. Modern science, especially after post-Popperian shift, described by, for example, Thomas Kuhn, shows that knowledge evolves and that complexity condition cannot be understood through a simple viewpoint or discipline. This is precisely the spirit from which the PNEI, Psycho, Neuro, Endocrine Immunology paradigm emerged. A model that recognizes the continuous interaction among the nervous, endocrine, immune, and psychosocial systems. And I can say that it reflects the complexity of human health for better than reductionist approaches. For this reason, we must move beyond rigid specialism. Conditions like chronic pain or stress-related disorders require, obviously, clinicians who are bilingual scientists, able to speak multiple scientific languages and integrate biological, psychological, social, and somatic perspectives. Only by overcoming disciplinary barriers can we develop models of care that truly reflects the complexity of human beings.
In our experience, one of the key factors in building a real community of health professionals is having a common language. That's why we started from PNEI, Psycho, Neuro, Endocrine Immunology. And it allowed us to review our own training and to teach other professionals within a shared framework, a shared paradigm. Indeed, the first courses we uploaded on MIBES Academy were about PNEI and the principles of integrative care or the fascial system, so to unite different fields and professionals. And psycho-neuroendocrine immunology comes from both scientific evidence and ancient traditions such as traditional Chinese medicine. And according to us, if people are to form a community, they need to speak the same language and understand each other. Too often professionals end up arguing among themselves just because they use terminology that is specific to their own field, but incomprehensible to others. And another fundamental aspect for promoting integrative care is providing training pathways that cut across different professions. In fact, when we talk about stress management, nutrition, physical activity, body awareness, or similar areas, we believe that these are skills every healthcare professional should have, at least for what concerns prevention and health promotion. Lastly, the cultivation of a community comes from the fact that teachers and students can go beyond our courses by collaborating through private messaging, forums, share materials, follow-up webinars, and other functions of our e-learning platform.
Diciamo, per la nostra esperienza, la difficoltà è veramente quella uscire dal proprio piccolo paradigma. Cioè, io sono Shatsuka, studio solo lo Shatsu, tutto il resto non mi interessa. Io faccio Tai Chi e Qigong, studio certi movimenti, utilizzo un certo linguaggio, tutto il resto non mi interessa. Ma perché? Perché trovare un linguaggio bilingue è cioè comunque richiede un impegno, chiaramente, no? Cioè è semplicemente questo, però è quello che permette in realtà la comunicazione tra professionisti differenti. Il punto è che noi stiamo cercando di invitare persone autorevoli, perché se lo diciamo noi, siamo gli alternativi di turno. Ma se lo dice il rettore dell'Università di Cagliari, professore dell'Università di Urbino, neurofisiologo riconosciuto a livello internazionale, se lo dicono altre persone che hanno importanza, autorevolezza, allora noi si spera che questa cosa vada a smuovere sempre di più nel tempo. Over the past 2 years, we have observed for us, two very clear developments. From one hand, a shift in the perception of the integrated care paradigm. For many professionals, integration once meant simply adding other technique. Today, increasingly, it means, for example, recognizing the person in their full complexity, considering stress, emotion, the nervous, endocrine, immune system, considering the posture, relationship, lifestyle, habits, and we saw that it's very important developing a shared therapeutic plan. Professionals are becoming more attentive, more willing to engage in dialogue, and more open to building collaborative care pathway with colleagues. From the other end, for us, a shift in clinical practice, yes, a shift in clinical practice. Users report improvements in the way they, for example, communicate with patients, assess clinical history, recognize the role of neuroimmune networks, integrate anamnesis, clinical reasoning, movement, manual therapy, and lifestyle interventions. These are real, continuous, and profound changes. The integrated model does not remain theoretical. It became part of everyday practice.
From an economic point of view, an organizational point of view, MIBES Academy is completely self-funded. We do not receive external financial support, so everything comes from our activities, courses sales, learning management system services for professionals and schools, streaming of national and international congresses, publishing books, or outreach activities such magazine and webinars. Through these channels, we also offer advertising spaces for companies interested in integrative medicine. And economically, this system is essential for sustaining our project.
Wow. So I think that many concepts in these interviews allow us to link to the next interview because the need to address to a multi variety of factors has been conceptually structured in the concept of environment that Sandra will explain to us. I just tell you that the interview that we have just listened continues with some other issues concerning the provision, for example, of credits, such as the ACM, the Continuing Education in Medicine credits that works in Italy, because these credits make these kinds of training more attractive to professionals who are required to achieve a minimum level of credits each year. And they also assure credited system that a standard of quality is also guaranteed, and it has to be considered important for the reliability of such courses. So I remind you that the full version of the interviews is available on the project YouTube channel. And now I'm very happy to introduce you the second interview with JRC. JRC is the Scientific and Knowledge Service of the European Commission, providing independent, evidence-based advice to support European Union policies. Carries out researches on many topics and even the healthcare and mental health. Now I'm very pleased to introduce you our special guest, who today is with us, and thank you so much, really, Sandra Kirk. And just to say to our participants who you are, Sandra brings over 3 decades of expertise in toxicology and integrative health research. After earning her degree in chemistry and agricultural sciences, specializing in biotechnology, followed by a PhD in pharmaceutical sciences at the Free University of Brussels. She led the in vitro toxicology laboratory at Janssen Pharmaceutica and was awarded the International Prize for Substitution of Animal Experimentation. So since 1996, Sandra has been a key leader at the European Commission Joint Research Centre, managing EU NetVal's network of laboratories, coordinating major validation studies, and receiving the Bjorn Ekvall Memorial Award. So with more than 100 publications and lectures delivered worldwide, she now leads multi-stakeholder teams on emerging health threats and the One Health approach, while she coordinates now the Decoding Depression initiative to explore resilience across the life course, or more precisely, to explore the environment, this concept, across the life courses for global resilience. So, welcome, and now let's listen to the interview with you, and then we come up with questions.
Very honored to share the Joint Research Center work on decoding depression and how it can integrate with Feldenkrais practice to activate resilience, agency, and nervous system recovery across life course. Because the Decoding Depression Science for Policy initiative recognizes depression as an environment-driven condition shaped by your personal, your social, your natural, your built, and your digital environment. The Feldenkrais Method enriches this framework by addressing the somatic environment, using movement, neuroplasticity, and body awareness to support self-regulation, anxiety reduction, and healthier brain-body patterns. So integrating Feldenkrais into prevention and recovery aligns with One Health, mental health preparedness, and life course resilience, since it provides an empowering, accessible for everybody, evidence-informed tool and method that bridges science, policy, and lived experience. And so together, Environome Insights and Feldenkrais practice offer a kind of holistic pathway for strengthening Europe's but also global mental health systems. So in the time allocated, I will show you a part of our work. So our GRC Decoding Depression tackles how we can extend our transdisciplinary knowledge, I would say, on adverse outcome pathways to depression and understand well the mechanism related to this to an integrative, holistic One Health approach. So one of the questions that I want to share with you, which was also asked to me to reply, is how can somatic disciplines contribute to understanding and addressing depression and related conditions when viewed through an environnomic and life course perspective? Well, I can say that somatic practices such as the Feldenkrais Method operate at this intersection of body awareness, behavior, stress regulation, and also social contexts, all of which are core components of the so-called depression environome. Remember, depression environome is the social, the personal, the natural, the built, and also the digital environmental factors. So they may influence protective and risk factors for depression, including chronic stress, pain, fatigue, reduced mobility, social withdrawal, and diminished self-efficacy. So from a policy perspective, these practices are relevant very much as preventive, supportive, and complementary approaches, of course, rather than only standalone clinical treatments. Now, what we are doing in overall, and I go quickly through that to understand a little bit more about European Commission Joint Research Centre. Actually, our work overall in many disciplines is to provide independent, evidence-based knowledge and science supporting EU but also global policies to positively impact society. And we are organized in 25 portfolios, and especially our portfolio is dealing with societal resilience, systemic disruptive events, and risk. And we try to enhance by anticipation, preparedness, and response overall global resilience. So, of course, our work was a response, an EU response to this document, a comprehensive approach to mental health, which has been issued in 2023. So answering also to this question, how does the European Commission Joint Research Centre support research approach complex, non-linear health phenomena, such as depression, chronic pain, and fibromyalgia? Well, overall, our research addresses complex systems, combining, for instance, biomedical, behavioral, environmental, socioeconomic data. And in the context of depression, comorbidities such as chronic pain and fibromyalgia are highly relevant as they significantly increase the risk and severity of depressive disorders. Challenges related to evidence generation for somatic disciplines reflect broader issues in mental health research. For instance, difficulty in standardizing intervention. There is really this environmental context dependency and also the need of really a lot of mixed methods evidence, from quantitative to qualitative and real world data and lived experience. So what we see in our work is that health in our preparedness work has a lot of cascading effects. Some of them are depicted because there is a link with, for instance, natural disasters, economic crisis, healthcare resources, healthcare infrastructure, and more than ever now also conflicts, climate change. So we're operating in quite a complex context. I show to you now this video, which shows a little bit the project we have been working on. So this video showed a bit the process, and important now for this audience is that we know, for instance, depression is really complex and multifaceted disorder, and it affects really millions of people, but many treatments focus on quick fixes like medication, and it ignores a bit the underlying environmental complexity. And you see a lot of comorbidities occurring. And what I also see now, this is a publication on the left side, is that a meta-analysis with almost 400 studies with lots of individuals. You see almost 350,000 individuals with chronic pain from 20 countries. They showed a very close link with depression and anxiety. So obviously the information that I was saying before is highly relevant. Now, clearly, I already introduced it. What we want to do is take a One Health approach to depression. And this is a document, which was recently issued to really deal with an approach that connects all this interconnected world. And this is what we exactly did for depression. So therefore, there is, in this One Health context, really a very important role of multidisciplinary, even better, transdisciplinary integration in improving mental health, depression prevention and care. And that's exactly what we try to do. We explicitly explored integration across sectors, and somatic practitioners can be considered in this context part of the broader ecosystem of mental health support, particularly in prevention, rehabilitation, and long-term condition management. So the key challenge is not professional recognition per se, but it's defining the interfaces, quality criteria, and appropriate use contexts that are meaningful for policymakers and health system. So here you see the report, and the material will be distributed, but already in the report I acknowledged already Feldenkrais community of their, let's say, importance in what I just highlighted in prevention and treatment. In the report, you can also look at how macro, meso, and micro level factors impact mental health policies and their integration with all society interventions we're talking about. Other aspects, of course, to this dossier is really recognizing very early in life, but also across life course, depression symptoms, and within the report you can find that. We also have lots of dissemination material, which you find here on the QR codes. And here on this slide, you see, in a nutshell, the key concept of understanding depression, which is really a dynamic interplay of personal, social, natural, and built environments. So on the 23rd of June, 2025, in Brussels, in the EU Policy Lab, we did a workshop, Decoding Depression and Future's Garden, where we brought a lot of experts together, very transdisciplinary, neuropsychiatrists, psychologists, artists, lived experienced experts, people from different policy DGs, people across different age levels. And there we started together to look at the environment and also to design together care policies. So within that context, it's also obviously important to understand what types of research are still needed to, for instance, to assess the contribution of somatic disciplines to the environmental-driven depression and mental health conditions. So here a few suggestions. So longitudinal and life course studies linking somatic practices to mental health outcomes, including effects on the depression adverse outcome pathway. Also research on mechanism of action, including, for instance, links to stress regulation, interoception, and body-mind feedback loops. Evaluation of the implementation contexts, such as primary care, workplace prevention, the effect of social prescribing, like Feldenkrais practice. This is also done already on walks in nature, and community-based mental health initiatives, and use of participatory and co-creation approaches aligned with specific methodologies, including, for instance, best practices to capture lived experience alongside clinical indicators. Now, what we are doing about additional needs of research data is really collecting and trying to collect a huge data pool by launching a survey which is aimed to increasing awareness and decoding depression together. This survey has as goal to understand how people find, evaluate, and use information, especially about depression, and how social, digital, and environmental factors influence these behaviors. The purpose of this survey, which we hope that the whole Feldenkrais community, practitioners, and those that are part of the Feldenkrais community will fill in, this is aiming to inform our scientific research and shape really inclusive, evidence-based mental health and communication strategies across the EU and globally. Last but not least, I want to thank you all from the Feldenkrais community for starting this journey stronger and growing together. Thank you all for listening, and to be continued.
Okay, thank you. Thank you very much, Sandra. I interviewed you. I edited this video, and now that I listen to you one more time, I'm so proud because I understand and I strengthen my understanding that Feldenkrais is completely aligned with the European Commission policies and what the European Commission is intending to promote for the next years. And I understand that if I compare to the Feldenkrais practitioner profile that I tried to present you at the beginning, at the start of this meeting, the Feldenkrais practitioner should grow up and get really aware of belonging to an ecosystem of health. And so we should understand much more than we are professional, both in rights and duty to contribute to these ecosystems. But we should grow up and upskill, find upskilling pathways for us so that these skills can make us able to work at our best and with the highest positive impact for anyone, for people at all. So I don't know if there is any questions to Sandra, or if Sandra you like to give us any further comment. But Uwe, please, I see you. Maybe are there any questions for Sandra?
Yes, we can start with the question for Sandra, but there are also questions for Sonia. So
okay,
you decide.
Okay, I would start maybe from Sandra that has just finished the interview, and so it's very fresh in our mind.
Sure. There was a question about, maybe summarize that, what is the state at the moment of being visible as a Feldenkrais teacher? Sorry. And what is needed to place ourselves in this position to be more visible and be more recognized? Maybe we can go from this and
okay.
First.
Maybe I can start to say that obviously I'm very grateful to my Feldenkrais teacher. I think I don't see all the screens in one go, but actually it's Antonia. And she has been, let's say, embracing art and science, which I'm also doing. I saw from let's say, the first statistics that you have been showing, Lorenza, that within your community, there are a lot of artists. I feel myself a very transdisciplinary profile, and I embrace a lot art and science, but this means also music and many of the, let's say, things we're talking about, so very transdisciplinary. How can the Feldenkrais community be more visible? Well, I did my best. You're notified as a community in the acknowledgement. I invite you all to read the report. It's going to a lot of visibility. We will do a promotion campaign on Blue Monday on the 19th of January with the report and the survey. And in the acknowledgement, we acknowledge a lot of communities. And I've been also acknowledging Antonia and this project, which was a bit the background if Antonia explained it to me. So that's, let's say, my do on it. But I think also within the presentation, you have seen how I tried to really link your work, you know, with what we are doing. And I think, I hope that I can be with you in January. I understood there is this in-presence meeting. I have another meeting in Brussels in that week because I'm operating GRC as different sites, you know, in different countries, Germany, Belgium, Spain, you know, etc., Italy. So I hope to be there. And so I think this is a start, maybe, to start doing things together. I'm also very inspired by the platform, which was educational platform from the colleagues that was presented before. So I think stronger together, growing together is really my hashtag. I'm not so good on social media, but you know, I'm trying to do my best. So maybe we can do something together. But you have seen how I see the integration and how I see the role and the importance. I can say also having really professional Feldenkrais teachers with, let's say, I had the fortune to have a very professional teacher. We did it in group. I thought there was also the community aspect because I could look to the others how to do the exercises really well, because I think it's very important. The basis is from really a physicist, which was very inspiring for me, the theory behind the Feldenkrais. So that's why I'm very, very much inspired with what you're doing.
So you see, Hove, this should be growing up and raising the cross even between us.
And
now on.
I saw Davide from Milano. I don't know your surname, but you just embraced the One Health world, because I saw your dog, I saw the nature, and I saw you on the screen. So.
Yeah, thank you, Sandra. I really enjoyed also the graphics of the health system being linked in all the other systems. That's a really holistic view, which is nice to see from also the scientific community to evolve more and more. And I think that's something we as a Feldenkrais community also have in common there. The second part of the question I'd like to mention is, what is the role of institutions and how can we establish us there more, or do you know institutions already that go into the direction of making us more visible in science, but also in politics?
I mean, I've been showing in the beginning of my presentation a document which is actually issued by the scientific advisory mechanism of the Commission, which is this One Health governance. So in many of the things, and I've been governing, as you have heard in the introduction, I've done capacity building over the member states of joining laboratories in all the different member states of trying to make best practice and best methods available at the OECD level. OECD stands for Organization for Economic Cooperation and Development. So what I think it's a lot of governance matter, yeah. And also bringing in specific events, maybe the one that you're trying to do already in Brussels, some key players together, some influencers, people that are really like me, had the fortune to embrace Feldenkrais in specific parts of their lives, because of course, I think you're the best ambassador if you feel yourself the added value of your practice. But it's a lot of governance, and to do well governance, we have to sit together. We have to discuss that, and you have to have some ambassadors that really deal with good ways of dissemination and governance. But I think you have done a lot already. I was quite impressed with the presentation in the beginning. So there you get the data and the science with the two pilot projects in Italy and Germany. Obviously, in the meditation community, I explained also to Lorenzo, you have a lot of, let's say, diagnostic methods that can be helpful. So, but on the other hand, there are other ways to get your science, your evidence-based science visible, which you started to do already in this project, which I think is quite it is an incredible good start also to show that to some policymakers, like it was done in the presentation today.
Thank you a lot. Looking forward to see you in Brussels.
There any question to Sonia as well? Because we are very fast approaching to the end, and we have one more interview to show.
Okay. No, I think that's fine. Oh, 1 second. I have to specify this question first. Maybe we'll come to it later. Yeah.
Okay.
Should I bring forward the other question to Sandra? Sonia, sorry. To Sonia?
Yes, yes,
Okay.
quickly.
That's a question about, in detail, how the collaboration between the physicists, the doctors in the pilot programs and the Feldenkrais practitioners went, and what was the outcome there and the problems. So, in short, maybe you start and I give a second sentence for it.
Okay. Fortunately, this was a key point of the two programs. In fact, in Italy, we found a little bit more easier take the collaboration with the physician, because the association of Italian fibromyalgia is eradicated in the institution, so have more contact with the physician and for the treatment of fibromyalgia. So we had a huge list of physicians that could participate. Instead, in German was one of the principal problems, finding this collaboration, due also to the fact that there is a little bit of there is the need of more consciousness and more responsibility of the pathology. So in German, we still talk about chronic pain, and we have to focus the attention on fibromyalgia. So we have a lot of association of chronic pain, but fewer of fibromyalgia. So we have also fewer physicians, fewer doctors that are expert of fibromyalgia and can have a vision to apply this kind of methods in the treatment of non-pharmacological treatment of the patients. So these are the key point of the weakness of the program.
Okay.
Okay. Is there any comment from you, Uwe?
I'm sorry, I have to multitask at the moment as I ask the questions in the chat and try to specify what's happening there. So I couldn't follow in detail what was said. But I heard that you mentioned the problem we had, like getting into the professional community of the physicians was a big problem, as they are highly formalized in their trainings with the credit point system, and we couldn't establish this credit point system for our training.
Thank you, Uwe. I should think, I don't know how many more questions we received, but the time is nearly finished. And I would like maybe to stop here the answering, but I invite everyone to take part in the next and final event of the project. In January, we will have the final event, will be an event in presence in Brussels, on Friday, 23rd of January. You are all invited in presence, but the places are limited. But anyway, don't worry, because you can also participate online. We will broadcast also the event online. And we will have some more times to interact with everyone, with the audience, with the participants, and so to have these questions and answer sessions. Now, I just remember who is leaving before the end, because I think that we will take 10 minutes longer. If someone is leaving earlier or now, please don't forget to fill in the questionnaire that you find the link in chat. This is a satisfactory questionnaire, and that this is very important for us to evaluate the present event. to better design the next one, and also to understand who you are exactly, because these kind of data are important in these funded projects. So thank you in advance, and I'll introduce you the third and last interview. It's the concern of the research and the studies, because one difficulties encountered in creating a common base of language concern the difficulty of presenting the Feldenkrais method and method such as this one to the healthcare world, because they require scientific evidence. So, Cliff Smith will introduce you the numbers of research studies and the main topics of research so far, and limitations that the International Feldenkrais Federation Research Group has done in the recent years. So I will share with you the interview. It will last 15 minutes. So
hello, everybody. Cliff Smith here. Just with a short presentation for your Felden for Life event on Feldenkrais research in the International Feldenkrais Federation. I'm sorry I can't be there live, but it would be 3 a.m. in the morning here in San Francisco when you are meeting. So I've made this recording for you. So here we go. So the agenda today is brief, just talking a little bit about the history of the IFF and research, talking about what research into the Feldenkrais method has been done so far, and then some thoughts and directions about Feldenkrais method and health, for wellness. I have a history with the IFF. I was joined the board at the beginning of the IFF, was there for 12 years, including a couple of terms as president. I've been a member of the research working group since it started, but I'm on leave from that right now. And I'm the editor of the research journal, and I've been a practitioner for a while. So I had that portfolio when I was on the board. So the first project really in relation to research was developing a database of publications about Feldenkrais method. Then in 1999, we started doing some work on kind of helping practitioners develop and kind of discovering more about what we do and what we can do better in the form of quality workshops and developing the competency profile. And that's also when the Feldenkrais Research Journal was founded. And sometime early in the thousands was when the working group was formed. So the working group one of their main projects has been the reference database, which it's maintained for a long time, and recently did a whole lot of additional work to upgrade it and update it. So it's a database not of research studies, but a database of everything that's been published about the Feldenkrais method, 1,152 items. But it's searchable. It's on this software Zotero. And what they did recently was to include tags, so it's easier to find a topic that you're interested in. Also for articles that are about medicine and healthcare and those kinds of things, there's tags about the levels of evidence that the article represents. And then there are abstracts for a lot of the papers, and translations were done for the abstracts to make the material more accessible. Oops. Okay, so then the research working group does other things. Particularly, it organizes events, presentations of research so far, presentations of research studies, and there are videos of those events available. And they've been used also, for example, with translation and to introduce the research information to the Spanish-speaking community. There's a small budget for sending people to present at conferences or to have panels at conferences, scientific conferences. And then there's networking, finding out who has interest in research, who has knowledge, connecting people. You can see on the screen from the working group website invitation to an event that was discussing research methods in the Feldenkrais method, and to discuss research and promote research. So there's been 7 volumes since 2004 with 90 articles, and we publish new research, particularly, pilot studies and new research from new researchers. There's also hypothesis and theory about the Feldenkrais method, reviews of the research done so far, discussion of research methods. And we also reprint some key articles that may be in other journals behind firewalls and things like that, and translations of articles. In fact, the whole of volume 7 has been translated into Spanish. And there's also material in that volume in German and French, or coming, and even our first article in Chinese. So part of the focus of the journal is really to serve the community. So supporting new researchers, new authors, helping people write about the method in and about the questions of research and the new research studies. So it's quite well read. There were 7,500 article downloads last year at the rate of, therefore, about 630 per month, listed here. So Hillier and Worley, with some help from the IFF, did a systematic review of the effectiveness of Feldenkrais method in 2015. They found 40 relevant publications, of which 18 were actual research studies. And 7 were of high quality and randomized controlled trials. Then Stevens and Hillier did a review looking at mechanisms of action and things like that, but they also added 7 more studies, including 2 more of high quality randomized controlled trials. Berland et al. In 2022 were looking at the usefulness of Feldenkrais for physical therapy practice as a physical therapy tool. They found 16 studies. And Martin, just recently in 24, looking at Feldenkrais method and clinical psychology, found 14 publications that they thought were relevant to psychology, including qualitative studies and other hypothesis and theory things, as well as research studies in relation to psychology. And then Nicholas Zollinger did a study supported by the Swiss Guild. And he did a scoping review of all the studies about motor functioning, about movement and related topics. Studies of all sizes and all qualities in the whole time that studies have been done. And he found 41 studies. And it's very useful to have that complete picture and see what was studied, what research methods they used, the risks of bias, all those kind of things for those studies. And then there's always new studies coming out, like the study from Georgie on fibromyalgia and her colleagues in 2023, the papers that were in those reviews. So there's this whole category of movement and physical function, including studies of dexterity and grip, of balance in general, but particularly balance and mobility with older adults. And that's probably the biggest body of research we have is on that topic of balance and mobility with older adults. Then looking at certain disease conditions and their impacts, particularly quality of life and specific quality of life issues to do with things like stroke, MS, Parkinson's disease, arthritis, bruxism, and mild incontinence. And then there's a kind of category of psychophysical, perceptual, mind-body kinds of things like anxiety and mood, work-related stress, also a balanced confidence, because there's the ability to balance, but there's the confidence in one's balance. Body image perception, study of how that's related to eating disorders, for example. Studies of perceived effort and perceived comfort in the body, interoception, and particularly pain. Quite a few studies, including high-quality ones of pain, chronic low back pain, neck pain, and as I mentioned already, fibromyalgia. And also some studies of the measurable physiologic mechanisms of action. So if Feldenkrais affects muscular tonus, whether it creates changes in the nervous system. There's a lot of variability in the designs, how much intervention, how many functional integration sessions or awareness through movement classes, what research methods we use, what things were measured. So there's quite a lot of different things that we measured, as you heard from the topics. And then there's different qualities. So there's a few randomized controlled trials that I mentioned. And then there's some trials that are controlled but not randomized, etc. Others are just simple pre-test, post-test studies. A lot of this research is done within their community, so there's potential bias. And I want to say, I have my master's and PhD students, they write literature reviews about things like Qigong or breathing practices or mindfulness or whatever, and yoga. And these are the things that they say about all the studies that they're writing about, that they're small, that there's a lot of difference in the designs, the quality is variable, partly because of the funding and institutional support and expertise that's available for studying these mind-body somatic movement practices compared to pharmaceutical trials. So this is common for many areas of health and wellness interventions that don't have the kind of support that the pharmaceutical industry has or the surgical instrument industry has. So these are things that need to be addressed. And we always have this ongoing question, as we should, about what's most important to study and what's the best way to study it. So some obvious responses to this, of course, are that we should try and find ways to have bigger studies, maybe more multi-site studies, maybe more studies across countries. And there would be value in creating more consistency in some of the designs in terms of interventions, in terms of maybe having some standardized protocols of the lessons that are taught in programs, and maybe more consistency in measures, or doing replication studies where we do studies with the same measures. And they could be ways that we could move forward with the research. They're obvious first places to go.
So, oh, sorry, it will start it again, sorry. Okay, so we took 10 minutes longer, sorry for that, but this interview deserves really a deep listening, because Cliff mentioned very interesting things about the recent researches and studies on Feldenkrais, and that makes Feldenkrais method more visible to everyone. So I think that at this point we should close, and I hope you found this webinar interesting. We invite you again to visit the project website, where you will find also the direct link to the YouTube channels where all these interviews are uploaded. And we invite you also to fill in the questionnaire of satisfaction which is very important for us. So please don't go away without filling it. And we finally invite you to the final event. If you register to the project or to our newsletter, you will get all the info and news. We are starting the promotion at now before Christmas, so you will have all what you need. So I thank again Sandra Cook for your participation with us today. I thank to every external guest that allowed these interviews, and we will meet them in January as well. And I hope to see you again soon. Have a good afternoon and a good Christmas time, everyone. Bye.